doctor, the first question that I would like to ask you is that there's a noticeable increase in heart attacks among young, very seemingly healthy individuals. And we often hear about people who are physically fit, going to gym, etc., suddenly collapsing and sometimes dying on the spot before any medical attention can be given to them. So why is this really happening? And are there some warning signs or symptoms that might be overlooked in these individuals?
Thank you. Actually, you have answered your question in the last sentence. Nothing comes from nothing. A heart attack can never come out of the blue. It is never a bolt from the blue. What happens that we ignore and overlook symptoms and signs, and not necessarily symptom and signs, the warning signals also. Like say, if you have got a family member who died at a young age, suddenly you have heard in your childhood that one of your uncles has died in the football field while he was 26 or 30. And it is just not a story, it's just not a fact. It has got the whole implication for the full family and the next few generations that we ignore. So a young person died who is your blood relation, suddenly without any warning, doing some good physical work or something like that, immediately puts you on a high alert that whether we are missing something, we are missing something in the family which is going wrong genetically. So this person, as opposed to another person who does not have a family history, must be much more cautious on the risk factors which may be developing in his body, which he is unaware of. Not necessarily all of them will come with symptoms or signs. And heart attack is an end result of these ignored risk factors which are not tackled in proper time, which could have been tackled if you are aware of the situation. And also the second part is that, as you mentioned, symptom signs are there, but people ascribe it to different other factors like, well, I'm aging, well, I have eaten too much tonight, that's what I had got a burping. Well, I am now under pressure of work, so I'm feeling fatigued and tired. But these are all symptoms and signs of an impending heart attack. So you see, sometimes we ascribe it, rightly or wrongly, to all these symptoms and signs, to other circumstantial things which are happening. So we must be careful. If we have time, we can discuss later on with a bit details about how we can handle this situation.
So what exactly are the common symptoms of a heart disease? Is it only chest pain, or there are sometimes more signs that one needs to be aware of?
True. Now, heart disease, I suppose when you are talking about heart disease in this forum, we talk about heart attack and related diseases. Because there are various types of heart disease. There are valve disease, there are pericardial disease, there are congenital heart disease, there are electrical problems, but that is too vast a subject. And if you take together the people dying of heart disease, 9 out of 10 of cardiac death come out of this ischemic heart disease, or what we nowadays call atherosclerotic disease. That means cholesterol deposition disease in various arteries and various blood channels in the body. Now, how will you understand? The first and foremost, the classical is pain in the chest. I can show you in this part. Now, there are certain classical phenomena about this chest pain. People never point a heart pain like this. If he points the pain is here, it is not heart. So they either put it like that or put it like this. So it is a diffuse pain, not a pinpoint pain. Number two, it may not be here only. It can be a jaw pain. It can be arm pain. So how do you know? The precipitating factor, what is bringing out the pain? If it is an emotional or a physical stress which brings out this discomfort, I would say discomfort, then it is possibly heart. Like when you are climbing stairs very quickly and hurriedly and under a bit of stress, and your jaws are a bit numb, your jaws are locking, then this is surely a heart disease. It is not gas, it is not some rheumatic problem. But if it happens when you are sitting or eating, the chance of heart is less. So the circumstance, how it occurs, is also very important. And third important point is how it is relieved. Say you are having a discomfort while you are walking, and now you stop walking, sitting on the park chair or wherever you are walking, say in a park, and you are sitting on the chair, having a cup of tea, and it goes off. That also points that it was heart to begin with. But if it persists, its chance of being heart is less. So you see that. Am I visible?
Yes, but something is on the screen. Yeah.
Yeah, now I'm visible. Yeah.
Yes.
So you see that the type and character of the pain, how it comes on and how it goes off. These three actually we take into consideration. There may not be some variation because it is biological phenomenon. It's not physics or chemistry. It's not engineering. It is medicine. So there are human variation, but this is grossly how we characterize the heart pain. But not only pain. It can just happen you get out of breath. That is a bit more, non-specific, because people get out of breath for various other reasons. Because he is tired, he is not accustomed to work, he has got lung disease, he is a chronic smoker, he is obese, he is anemic. All this can cause breathing trouble, but heart is also there to cause breathing trouble even without pain. And thirdly, nowadays we recognize that undue fatigue towards the end of the day, we ascribe it usually to work pressure, to depression. There's not much of social time we are giving, not much of hobbies we can pursue. We are always working. So at the end of the day, we feel not feeling like working anything, just go to bed and take rest. That can also be, that fatigue can also be an early symptom of heart attack or impending heart attack. So these three, pain, breathing trouble, and fatigue, these three they are any combination, they can actually indicate that heart disease may be there. So we have to be more careful and go for investigation or explore it.
Doctor, this was quite eye-opening, and you touched very briefly about stress and anxiety. And this is exactly what we often talk about, that stress, anxiety, and lack of proper sleep or less sleep. Sometimes even working across time zones, and not getting that 8 hours of sleep, which is recommended. So, do these individuals are at increased risk of heart disease, and what can individuals actually do to manage stress or say change work habits which could support their heart health?
I'll tone down a bit because otherwise people who have to do this kind of work will feel rather let down and feel rather depressed and frustrated. So I would say we have to do what we are supposed to do to earn our living and to live a happy life. But we have to be careful at the same time. So when I am sleep deprived from some reason, when I am stressed and anxious, when I'm overworked and frustrated, maybe I'm not coping well with my seniors or my juniors, then we have to find out way out from those situations. Otherwise, they can ultimately cause harm to your health. It increases your blood pressure, it increases your obesity, it increases your diabetic tendency, and ultimately all culminate to heart disease. So I would say, which is now the typical Indian thing, which the Westerners are now adopting more aggressively than the Indians, is yoga and pranayam. So yoga and pranayam is our traditional thing we forgot in between. But I think the time has come, we should re-inculcate the practice of yoga and pranayam in our day-to-day life. Not only it is a jogging in the park in the morning, that is very good. But at the same time, some free time, half an hour with yourself, when you can concentrate your mind, when you can do the breathing exercises, when you can practice some simple asanas, can actually do a huge benefit to your body and impact your positive health. And also, of course, as you said, the waking hours, there could be counselors for that, how to cope with the sleep. And also, sometimes we ascribe it that it is our job, we can't help. But many times you will see it is not our job. It is our mobile phone, which is taking the sleep away. I mean, 2 hours after going to bed, you have got free time to sleep. But 2 hours you are on your mobile and chatting and doing all the rubbish things which really don't matter if you stop it. But this has gone into our habit and into our practice, and that is curtailing your sleep hours, not curtailing on your working hour. You cannot do anything on that. So actually, which is suffering is sleep hour. So I think we should look back. We should stop and look back what we are doing. And if we do stop doing this Facebook and doing these WhatsApp chats and everything, do we really miss a lot? We may not. Rather, some light music, some good reading of books, half an hour before going to sleep, perhaps has got a very positive impact on your body and mind. So, I mean, it's individual, it's my own opinion. I am also sometimes victim of this strain, but of course, we must preach what should be ideal. And I would say practice yoga pranayam, practice some good habits, practice some outdoor life, like going to the clubs or going to the park, to have some free time chatting with your friends, not on mobile, but face to face gossiping, maybe on a cup of tea, maybe on a game of badminton, maybe during swimming. These things are very important, and starting from childhood. If you see a child at 7 o'clock, he goes to school. At 12:30, he comes out. Then his mommy takes him to a private tutor. There he goes to 6 o'clock, 7 o'clock. Then he comes back home, takes something, then do the homework till 10 o'clock or 11 o'clock. This is not life. And these years of life, these formative years of life, the teenagers, you will never get back. You will have 40s and 50s and 60s and 70s for a long time. But 10s and 15s and 20s are only for a few years. So you have to give proper credence and proper value to these formative years of life, when you form all your habits, good or bad. And there also need the parental help, as well as the help from the school and outdoor life, social life, to interact with people. A standard boy nowadays or standard girl nowadays don't know how to talk with his friends. He can talk very well on his mobile, but when they're sitting together, they can't talk to each other. They're talking in front of each other, they are chatting with each other in the mobile. So this trend is absolutely bad for heart or overall health. So I think we as parents also have got a responsibility to bring them back to healthy lifestyle.
Absolutely, Doctor. I think you have touched upon some very important, lifestyle and social messages out there, and that we all should practice irrespective of our age.
We
And
hope.
you also briefly mentioned in the beginning about genetic tests. I mean, genetically, it could be affecting people. So, are there any genetic tests available that, suppose there has been history in the family, which people
Sudden death.
know about? So, can they really use these tests to really screen themselves? Like, for instance, in case of cancer, there are some that we hear about.
Excellent question, Saumitra. Now, two ways. One is, some genetic things manifest themselves in a known pattern, like blood pressure is genetic, blood sugar is genetic, blood cholesterol is genetic, obesity is genetic. So you know that you can check these parameters. If somebody in the family has died young or is suffering from heart disease from a young age, you know that you are more prone to get the genes for pressure, sugar, cholesterol, obesity from him. And you should check that whether you have already inherited those. And these are easy to check. But a large area which is genetic, but we do not know how that gene manifests. So nowadays we are doing the gene banking and data pooling, and in UK it is very active now. In India also we are doing, to find out a particular genetic pattern where you can predict a catastrophe or an event without exactly knowing how it is manifesting. But as long as we know that it can cause a sudden disaster in the family, then at least you are aware and you are on your guard on the known factors. Like you must not start tobacco use in your life. If there is a family member who died at the age of 25, you must not start tobacco use. You must check your sugar, pressure, cholesterol by the age you are 18, not by the age you are 40. But 18 is the cutoff now. We are telling from all the societies, all the medical societies, that at the age of 18, you have a thorough body check. Maybe like corporate hospitals like Woodlands and all other hospitals offer a health check. So do a health check. You do not know, you may have blood pressure already starting. Your triglyceride may be high. And you'll be surprised to know there was a paper published 5 years ago from Delhi area. In India, among the teenage children, 1 in 5, 20% of children are already high blood pressure. You cannot believe it. And I talked to many of our clinical forum, and I asked my colleague doctors, have you checked the blood pressure of your teenage son or granddaughter? And 9 out of 10 say, we never thought of it. So you see, we miss it at our own home. We don't think it is necessary to check the pressure of a 15, 16 years old boy or girl. And many of them are already hypertensive. They're already obese. We do not care about their body weight. We do not check the BMI, which is so easy. Just click in the Google, just put the height and weight, and you know whether his or her BMI is in normal or it's abnormal. But we miss these small points. So I think it's very important to go through things. I forget about the genetic analysis, which is far off, which is maybe we'll wait for another 10 years. But what we can check every day, that we should check before it is too late. And also very important for young people is the drug addiction. You know, that I have seen many heart attacks by the age of 25 or 30. And you know, most of them are either genetically high cholesterol people. That is a particular type of disease when your cholesterol is very high by genetics, or they are addicts. They're addicts to cocaine and some stuff like that. So that is another very important cause of early or teenage heart disease. So we have to be careful on that as well.
So looking at another side of things, in slightly aging, and particularly women. So do hormonal changes with aging make them more prone to heart attacks or heart diseases?
Yeah, somehow females live longer. They have got more survival tendency. God has given them that extra power to survive, because human beings try to kill, the men try to kill ladies, but God somehow has given that extra protection, because God anticipated how men will behave. So what happens, the hormones actually till the lady is menopausal give some protection to ischemic heart disease. So heart attack is distinctly uncommon. I mean, I would say not uncommon, but much less to a comparative age man. Say a 30-year-old man is much more prone to have a heart attack than a 30-year-old lady. But after the menopause, 48, 50, whatever it is, females quickly catch up. And sometimes they overshoot. In certain communities, a 70-year-old lady is more prone to have heart attack than a 70-year-old man. So they catch up. Their initial benefit they lose once the estrogen goes out from the body. And at the same time, there's another important thing is that females, when they have heart attack or any disease, they are less attended. The attention of the house or the home is less on a female. It has been proved now time and again in all societies across the world that females are a bit neglected as far as the health is concerned. So even when there is a genuine heart attack going on, a man is more likely to land up in the emergency very quickly, and a female is less likely to land up in the emergency that night. She will try this and that. Nobody will take care of her, and ultimately she has got a bad outcome. So this is a mindset which is not in my hand or your hand. It should be a societal change in the mindset, and not in India. It's across. In America, it's more. In America, it's more. Europe, it's a bit better. So we have to check the female disease. So that's why there is a, now, in the cardiology community, last year was dedicated to females, the women heart disease. Now we are trying to empower women to know about their heart disease and to take their health in their hand rather than depending on the male counterpart to take care of them.
Doctor, we also often hear about people, particularly middle-aged individuals, suddenly suffering heart attacks in the middle of the night or early in the morning. So is there any correlation between this timing? I mean, why does it happen at these times, and what could be done to prevent such occurrences?
I won't say, usually the stroke occurs very early in the morning when the person goes to the toilet at 4 o'clock or 5 o'clock in the morning. Heart attack, what happens, sometimes the night blood pressure increases. Sometimes if sleep is inadequate, if the person is obese or smoker or snores a lot, during sleep his oxygenation decreases, and his blood pressure increases. So these are the two important factors to precipitate a heart attack. More often than not, what happens, the discomfort is going on since the afternoon or evening, and he was taking antacid and stuff like that. But at 12 o'clock in the midnight, he thinks enough is enough. Now I have to go to hospital. So it is that timing of the psychological timing that perhaps now night is coming, I may not get any help. So that's why they go.
That's when there is an alarm, whereas
there's an alarm.
might have
But
happened much earlier.
If you closely ask them, no, it was actually from yesterday I was not feeling well. And today afternoon, I had to take this and that medicines, and now it is very bad. So he actually missed the usual initial alarms.
So in case of heart attacks, we have heard that the initial few minutes are very important. So what is exactly that time frame that one has between an incident and getting medical help?
What happens, what is if you picturize in your mind's eye what is happening, heart attack means one of your major conduits of blood, which is taking oxygen and nutrition to your heart muscle, is getting blocked. Now, once it is getting blocked, the muscle which it supplies is dying. To some extent, this dying muscle can recover if you give oxygen in proper time. But that time usually goes after, say, 2 to 4 hours. After that, even if you pour him with blood and oxygen, that muscle will not come back. So the whole urgency is to restore the blood supply as soon as possible. And we say first 30 minutes or 1 hour is the golden time. If you can restore the blood flow by that time, then nothing is lost. You won't even be able to recognize there was a heart attack just before. So it is so good. After 1 hour, with every hour, you lose the benefit. And after 12 hours, you may not get any further benefit by opening up the artery. So that is why the urgency. So what we say that when you are feeling that you are having something unusual, do not call your house doctor. Do not wait by taking some antacid. You rather go to the nearest emergency, do an ECG done. If the ECG is normal, you get time to analyze your symptoms or what is happening. But if the ECG is abnormal, you are fast-tracked in the hospital, in a proper hospital, to the immediate cardiac cath or whatever is the proper way of tackling. Maybe medicine, maybe angioplasty, whatever is that. At least you are in the radar of modern allopathic medicine.
And do you think there is any link between COVID-19 and increase in heart diseases?
Oh, yes.
Is there a correlation that you feel is there
Yes.
as a medical practitioner?
Yes, sadly, yes. From the Cardiological Society of India, of which I'm the vice president at the moment. So We actually published papers on heart attack and COVID, heart failure and COVID, arrhythmia and COVID, and we found by lots and lots of analysis with thousands and lakhs of people that COVID was, initially COVID was thought as a respiratory disease, adult respiratory distress syndrome, and being treated in that line, and people are dying. Then people discovered, so timely, thank God, that it is a thrombotic disease. Bloods are getting clotted everywhere in the body. And that caused heart attack, that caused brain stroke, that caused lung, that caused limb injury, that caused gut injury, kidney injury. So, and then the blood thinners were given and COVID changed its pattern. And the COVID mortality drastically diminished after the blood thinners were given as routine treatment protocol. But initially, first 6 months, nobody could understand what was happening. Now, as every day going on, we are seeing after a COVID attack, a person is not the same person, including ourselves. Something somewhere has changed very subtly. Somebody may have a gross heart failure. Somebody is going pushed towards heart attack. Some are not breathing properly. If you do a CT scan of chest, many people will see the lungs have shrunken. To some extent, it is fibrosed. It is rigid. Some people are saying, you're not the same person. Your personality has changed. You are not that irritable before. You are not that forgetful before. So something has changed for the worse, either in the brain or in the heart or in the lung. COVID has left its mark, unfortunately, to everybody whom it attacked. We still do not know what is the full impact on the health of a society or of a nation of the COVID. Every day there is new papers coming showing these are the effects of after effects of COVID we are still facing. So we have to be extra careful in this era that we are not being pushed towards a heart attack or a heart failure or a brain stroke, etc. by checking our risk factors more aggressively, more frequently, and controlling them more optimally.
That's really the unfortunate effects of COVID-19 that we are left with. Now there's a question in the chat from Sudhakar, which I would like to take before I move on. He asks, is snoring also the indicator for future heart attack?
Yes. What is snoring? Snoring means your airways are blocked. So during sleep, during active time when you are awake, you actively give the effort to take a deep breath and your muscles work. But when you are sleeping, your muscles get relaxed. You have got no brain control on your muscles. And if there is obstruction in your airway from nose till lung, then you do not get adequate oxygen. And so you try to subconsciously take more oxygen, give an effort, and through an obstructed passage, if the air flows, you get the sound of snoring. It indicates your obstruction in the air passage. It then indicates that your blood is not getting enough oxygen. So snoring means you are having less oxygen in your blood. Your brain, your heart, your kidney are not getting enough blood while you are sleeping. So there is a test called polysomnogram. Those people who snore a lot, we do a polysomnogram, and it measures 7 parameters in the body. Your ECG, your blood pressure, your heart rate, your oxygen level, and so on and so forth. And it has been shown that those people who snores, they have got severe stoppage of respiration at some point, and then they suddenly break through. You will see it is a very common experience of a wife or a husband or the partner of who snores, that sometimes he's absolutely still, as if he has died. And then suddenly he jerks up and takes some very snoring and very loud few breaths and again goes into calm phase. So this jerky, this sometimes you are not breathing, sometimes you are breathing heavily. Oxygenation is very erratic. This is a very important cause of heart attack, cardiac arrhythmia. Not only heart attack, your heart gets irritable. and suddenly there is an attack of rapid fire, what we call ventricular tachycardia or ventricular fibrillation, and the person suddenly dies during his sleep. As I mentioned, as you said, that midnight heart attack, snoring and obesity is one of the causes. So whenever you snore, you try to find out why you are snoring. Is it your smoking? Is it your obesity? Is it your some tumor or polyp inside your nose? So you see your chest physician, you see your ENT doctor, and try to get rid of the snoring. And there is now very good machines available called CPAP machine, which you can put a mask during sleep so that the air is forced into your lungs and you do not have the oxygen problem during night. And many people say they give absolute feedback, their life has changed. They say, why didn't I use it before? Now I'm a free man. In the morning, I wake up fresh, like there is more air in the environment. Birds are singing more sweetly. The breakfast tastes nicer. So everything in life has changed because of a good night's sleep without snoring. So don't ignore snoring. Take it with proper perspective.
Doctor, now coming to the screening and detection of heart problems. So, what are the routine tests that one should do? Are the routine blood tests and blood pressure monitoring or ECG sufficient, or are there more sophisticated tests? And how frequently should these be done?
Yes, as I mentioned, unless there is more severe indication, all citizens should have their body checkup done at the age of 18 when you are just going out of your teenage, 18, 19. And you must check the blood pressure, the blood sugar, the lipid profile, which gives a comprehensive look, your hemoglobin, whether you are anemic or not. And depending on your situation, whether you need a liver function or a kidney function or a thyroid function, those are optional, those are not routine. And ECG gives a lot of clues, particularly if there is some congenital problem. You know, there are sudden young death, I would say, not heart attack death, but sudden cardiac death is not always heart attack. Sudden cardiac death may be due to arrhythmia, so rhythm disturbance. And rhythm disturbance may occur with a few congenital heart disease, particularly visible in the athletes. Young athletes, 20 years, 22 years, doing a javelin throw suddenly died. So actually there is a lot of talk that whether a routine ECG test could have helped those people. And various Western sports academies and sports councils and societies, they make it mandatory to have a routine health checkup and an ECG before joining a regular training program. Because there are certain features in the ECG which make you vulnerable for sudden cardiac death. And if you can detect those, you take proper care, you may avoid certain sports and activities in life. Not only sports, you might have to choose your occupation accordingly. You might have to change your hobbies accordingly so that you can have a proper and uneventful life. So ECG is very important, but depending on the clues you get, as you said, we go into further tests. Like if the person as 18 is absolutely okay, we do it after 5 years or after 10 years. And after 35 or 40, we do it every 5 years. But at any point, if you get anything going wrong, either your pressure, sugar, cholesterol, body weight, your ECG, your hemoglobin, then you have to explore the path further. Might have to do a treadmill test. You might have to do an echocardiogram. Even in certain cases, angiogram, CT angiogram, or certain Holter test. There are lots of tests, you know, in cardiology, but it is not for common discussion. It's your duty if you detect something wrong in your body, either by symptom sign or by the routine health checkup report, which is marked in bold, out of range, you should consult your general physician and he will guide you to which type of specialist you should go. That should be the way a society should move.
Doctor, another very topical thing is the wearable devices like smartwatches. These are very popular these days, And these are increasingly being used for monitoring heart rate and activity,
True.
oxygen levels, for instance. So, how effective are these devices in detecting early signs of heart problems? You know, some watches actually can give you like, you know, that ECG kind of a report, you know, with your heart activity, and you can take a printout. So, are these reliable enough?
I'll give you in proper perspective. If you go to any international cardiology seminar, you'll be surprised to see how many gadgets are there. Now, even a watch is outdated. Now you have got a vest, you can have an undergarment, you can have all sorts of gadgets you can wear in various ways, like socks. So the whole idea is to detect something in your day-to-day life. You don't have to go to a doctor's chamber to detect it. Yes, it has got good and bad things. Particularly the artificial intelligence, it is getting more and more sophisticated. So you detect particularly your pulse, your blood pressure, your oxygenation, your body temperature, and most importantly in our clinical parlor, a kind of arrhythmia called atrial fibrillation. So if you detect atrial fibrillation by smartwatch, the problem is that we are still not quite equipped with the knowledge, what to do with the knowledge. I mean, if a young man comes at the age of 25, that his smartwatch has given him, there is atrial fibrillation going on 10 minutes a day. No doctor in the world is sure enough what to do with this knowledge. So knowledge sometimes is not that good. Ignorance is bliss. That's a good old English saying. But, you know, because this young man will be hooked to his heart. He will look to his smartwatch all the time. My heart is not right.
And probably that will give rise to stress.
Yes. And he will be a sort of cardiac moribund patient psychologically. So I am not at this stage sure whether we should overdo it or not. If there is a suspicion that I have got palpitation, but nothing is detected. I have got a small stroke, but nothing is detected why it happened. Then of course you go all out to find out the reason, to get any clue. But just for fun, don't do it. It may not remain a fun. It may become a kind of nemesis in your life. So use with your wisdom. I leave it to individual person.
Now, coming to another area, food and nutrition. So,
Oh,
what kind of diet is generally good for maintaining the heart health, and what are the things that one should avoid?
you know, it is an endless story, endless talk. The rule of thumb is whatever looks and tastes good is not heart healthy. And whatever is ugly, bad smelling, bad tasting, they are very healthy. So that is the big term. But how to go between those? We nowadays say that carbohydrate is the worst thing, worse than fat. So be careful on your carb diet. And carb does not necessarily mean rice and chapati. Carb includes, I'm talking in Bengali terms also, chide, muri, khoi, biscuit, pasta, Maggi, idli, everything is carbohydrate made of rice or wheat. So just go easy on rice and wheat product. Take rather more protein and balanced protein, both vegetable and animal protein. If not possible, animal protein, good quality vegetable protein like pulses and rajma and paneer and stuff like that. And plenty of fruits and vegetables. There is no substitute for fruits and vegetables and nuts. Okay. And lean meat, lean fish. Um, I mean, lean meat, lean fish, these are very good. Egg is always a query. What to do
Yes.
with egg?
Yes,
Egg is
especially the egg yolk. Sometimes we hear that egg yolk is good. Sometimes you should avoid and have only the white. So,
so
yes.
egg is the most wholesome food ever produced by God. Most wholesome food and most health-friendly food. Now, egg has got two parts. The white is made of protein. So you see, those are bodybuilders. They take 20 egg whites every day. So get the protein, easily digestible protein. Similarly, those people who have restriction of protein, like kidney people, kidney disease people, they should not take egg white because it is protein. Who are recovering from cancer or infection, who need more protein to build up the body, they need the egg white. What about the egg yolk? Egg yolk is pure cholesterol. Now, this cholesterol, how bad is this cholesterol? It contains about 10, 12 gram of cholesterol, 13 gram of cholesterol. So this cholesterol is minusculous for the body pool of cholesterol. Cholesterol, 90% is produced in the liver. 10% are obtained from the intestine, from the food. So by reducing or stopping all cholesterol, you can at most reduce 10% of your cholesterol. So your 100 LDL cholesterol may go to 90 LDL cholesterol, which is not a very big impact. So I would rather say, take egg, maybe every day for a healthy person, 1 a day, but make it boiled or semi-water poached. Don't fry it. Masala omelette is one of the most notorious food which Bengalis like, masala omelette. So that contains a lot of oil. You know, the oil is the worst part than the egg itself. So 1 full egg, boiled, half boiled, or water poached is good. If you have got specific health condition, you go by a kidney problem, very severe cholesterol in your blood, then you go by your doctor's choice. Lean meat, chicken is good. Goat, all the guideliners all over the world could not decide whether goat is lean or goat is fat. Their red meat starts from pork. So where goat stands between a fish and a pig, we have not decided. So till we do not decide it, let's have some goat once in a while, but lean goat with the fat out. And the cooking medium must be, very healthy. You have got stew or very lightly cooked food rather than, that rich biryani. That might be a bit harmful. And plenty of fruits and vegetables and fruit juices, unless you have got specific problem with fruit and juice. Of course, if you have got diabetes, you have got your restriction. If you have got liver disease, you've got your restriction. But generally, and the nuts. Nuts in moderation is very good. Few nuts a day, 5, 6, 10 a day, not the whole box of nuts. And the fish, people say that oily fish, particularly the seawater fish, we do not get that much of seawater fish in West Bengal, but still we get the hilsha and the vetki and the pomfret. These are 2 or 3 fish which are almost sea fish. They are fish, that fish oil is good instead of rohu or katla, whose oil is not that good. So you can take these fishes with the oil, which is good, but must not fry that oil. Once you fry that oil, that good oil becomes a bad oil. So you have to grill it, or you bake it in the oven, or to change the cooking style to keep the food healthy. That much I can say.
Doctor, another very debatable topic is the use of oil. In fact, some companies even market their oil as good for maintaining a healthy heart. So are these claims true? And also, at times we hear mustard oil being healthy. Sometimes it's olive oil. Sometimes it's ghee, which is a superfood. So very quickly, what is your take on this?
Yeah, there are 2 types of basic oils. One is saturated, one is unsaturated. Saturated oil is bad. Bad, and bad. I mean, that is dalda, palm oil. Those are saturated fat. You must not take those. Unsaturated fatty acid, maybe monounsaturated, polyunsaturated. Both are good for heart. You take a mixture. So I recommend 3 types of oil to keep in the kitchen. One is the safflower sunflower oil. One is the white oil, rice bran oil, linseed oil. This is white oil. And third is mustard oil. All 3, if you mix in different cooking items, they give you a balanced omega fatty acids, omega-3 fatty acids. You see, so you have to take, these are called PUFA, polyunsaturated fatty acid, monounsaturated. So you have to have a balance of different type of oils, not just a single type of oil. Olive oil is very healthy, but it doesn't go with the Indian cooking style. So you keep everything in your accepting dalda, but use it in moderation. Important is the quantity, not the exact oil you are using. And second is ghee and butter. It has been shown by our very, very erudite doctors and epidemiologists from Punjab, Haryana, Rajasthan area that ghee is actually good for health. Not the commercial ghee, which is adulterated, but homemade ghee is good for your health. But you have to digest and burn out that ghee by working, by walking, by toiling yourself. You take a spoon of ghee and then you whole day you sit down on a sofa, that is bad. But if you take 3 spoons of ghee and go to the field and work and do tractor and work there for the 6 hours, then that ghee is actually good for you. So depends on who you are and how you are utilizing other parts of your time and life. That also depends on your food choice. So ghee, butter is not as such bad, but in moderation.
So we've got 2 questions on this topic, so I'll just quickly read out. One is, what is the cause of high cholesterol and triglyceride if external food is the only to blame 10% of the load? And another is, what about coconut oil?
Cholesterol and triglycerides are completely different. Cholesterol is genetically determined. 90% is genetically determined, 10% coming from your food. Triglyceride is almost completely from food. So triglyceride comes from carbohydrate, not from fat. So that's what I told at the beginning. Absolutely, the sugar and carbohydrate. That's what I'm telling from the beginning, that go low on your carbohydrate and sugar, which actually increases the triglyceride. Triglyceride is fully dependent on your diet. And so it is varying so much. You fast for 1 month, you do healthy lifestyle, your triglyceride will be 100. And you again go to the societal meetings and night parties, and it will be 500. But you see, cholesterol does not change so much. It depends only on if you are taking medicine or not. Otherwise, it remains same. It is mostly genetically determined. But I'm not saying that you can take anything on cholesterol, but it's much less important. But triglyceride is completely dependent on food. So be very careful on your food. If your triglyceride is high, be very careful. Another thing you asked, I forgot. I just missed.
A coconut oil.
Coconut oil is bad. It is bad. While I was talking about these 3 types of oils, I did not mention coconut oil. It is full of saturated fat. So try to avoid coconut and coconut oil. Maybe for pleasure once. I mean, you know that a huge community from South India depend on coconut oil, but you somehow have to burn it out. You have to work hard, and you have to check your blood lipid levels and triglyceride level, and get rid of the coconut oil as much as possible. I mean, you can use it, but lesser the better.
Doctor, coming to a very important area now, managing emergency situations, which many of us worry about. So in the unfortunate event when someone is having a heart attack, in the family or people around we know, and especially if medical help may take some time to reach. So what is it that people should do? Because many people are actually trained in providing first aid. So do you recommend people to actually learn CPR, or what do you recommend? How should they handle a situation?
CPR is highly recommended to be learned by everybody. The basic CPR, not that there are 3 levels of CPR. So basic CPR should be taught in schools and colleges, I believe. That must be taught in schools and colleges, and by regular workshop in the offices. Maybe once in a year, even the RP Sanjeev Goenka group can arrange a CPR workshop where people can come for half a day and see how things can be done. I think this is essential for your family, for any bystander on the street. So this is very, very important. And just not heart attack, anything can cause a cardiac arrest. But when you're thinking of a heart attack, that you are having excruciating pain and sweating and breathless, the first thing of the family members or the patient is to allay the anxiety, because anxiety is actually perpetuates and amplifies the wrath of heart attack. It causes more sudden cardiac arrest. So allay the anxiety, try to allay the anxiety. Lose all the garments so that the oxygenation, at least the blood flow grows. Keep him in comfortable situation. If possible, get a sorbitrate type of medicine, under tongue nitrate, there are different names. So you can give under tongue. Try to keep a hand on the pulse of the heart, that the patient is breathing and pulse is there. If you think the patient is going off and you do not know the resuscitation, what you can do, at least that lay the patient on the floor and just put a thumb like that, a big thumb on the sternum, on this bone. That might bring 50% of patients going into cardiac arrest back to life and give you some time for proper resuscitation. Of course, there will be other. I don't recommend anyone to do the chest compress unless they know it, unless they are trained, or at least a little bit of knowledge on that. And the second thing is that immediately call the ambulance. Don't wait for any doctor to come. This is an absolute wastage of time. So call the ambulance, go to the nearest emergency, and they will do the preliminary treatment and investigation. If they don't have the facility, at least they'll send you to the better hospital, but you get the preliminary medicines by that time. The blood thinner, the aspirin type of medicine, anti-cholesterol medicine. These are given as a loading dose, 4 or 5 tablets given immediately. And that can rescue a lot of the muscle and can restore the blood flow in many cases. So don't miss the opportunity to go to the emergency immediately. I mean, if your favored hospital is 1 hour away, don't go there first. Go to the nearest emergency, which may be 5 minutes away, get the preliminary treatment, and then get transferred to the referral hospital.
I actually wanted to ask you about Sorbitrate. So is it something that anybody having a heart incident like this can take, or is it like, there are some restrictions, people with diabetes cannot?
Firstly, it's a bit unethical for me to utter the term Sorbitrate because it's a brand name.
Yes.
I would rather say isosorbide dinitrate, but nobody will understand that. So yes, this is the kind of lifesaver, but with some thorns. This rose has got thorns. If your pressure is low, say 100, 105, maybe originally your pressure is low because you are getting treatment for pressure, so your pressure is low. Or maybe due to this heart attack, your pressure is going down. And then if you put that stuff under your tongue, your pressure will fall precipitously. And many people, believe me, have just passed out by putting that stuff under the tongue. And once its reaction is out of the body, they again come up. So you really do not know what can happen. So the basic rule of using the isosorbide nitrate is that you put 5 milligram under your tongue in a sitting or lying condition, not on a standing condition. I had got tens of patients who were in the fish market or somewhere in the morning, just felt some uneasiness, put a nitrate under the tongue and fell, slap on the fish. And they are brought into the emergency. So never take it while you are standing. Either you sit down or lie down and put it. And second, as soon as your distress is relieved, spit out the rest of the tablet. Don't wait for the whole thing to get dissolved. So your job is over for the moment, get rid of the stuff because it will do more harm than good next. So these are the 2 ways to protect against nitrate, but use nitrate a bit cautiously.
Doctor, now coming to some conceptions, I don't know whether to call them misconceptions, I would say, perceptions that people have, that a glass of red wine a day helps in preventing heart diseases or keeping your heart healthy. How true is that?
Those good days are gone, actually, madam. I mean, People are getting very cruel, They don't allow you to live happily. So yes, it was shown that red wine has got some kind of antioxidant material coming from the skin of the red grapes, which actually keeps the body salvaged from many harmful toxins, and also reduces diabetes. And there are a lot of good things. I gave a lot of lectures on red wine. Nobody sponsored, thank you. So on various, but of late, we now recognize that any form of alcohol, whatever be the shape and form, is not good for health. Particularly, another bad news is, particularly for Indians do tolerate the alcohol badly compared to a Caucasian. By our genetic structure of our liver, we cannot handle alcohol in the liver. So we go more into liver problem, we go more into triglyceride, we go more into heart attack and heart failure with alcohol. So we have to be very careful. And you know that about 5 years ago, World Health Organization said that 3 units per day for men and 2 units per day for females were safe level. Not good level, but safe level. But nowadays they have reduced it to 2 for men and 1 for ladies. So even less. And also somebody say, okay, I will collect my weekly quota, and 2 into 7, 14 units I'll take on Sunday. That is also bad. 2 units a day means 2 units a day. That does not mean 4 units in 2 days. So binge drinking is very bad anytime. Binge drinking never should be encouraged, but social drinking is okay. I mean, lots of things we do which are not so healthy. So 1 or 2 glasses of wine or whiskey in a party, I can never say no unless there is specific health condition to avoid that, like liver problem and so on. But don't overdo it. Don't take it in empty stomach. That can raise the blood alcohol level very much. And don't feel assured that I am doing a good thing to my health by taking the wine. That is a wrong concept. You do the sin, but your conscience should be clear that I am doing a sin. Don't hoodwink your conscience. Your conscience must be clear.
And what about green tea?
Oh, the Chinese take it, and nowadays Indians take it. Yes, maybe good. Lot of stuff, lot of commercial pressure also. Anything green, anything biological is good. However, it tastes.
Is green tea actually better than our black tea? The traditional black tea.
I mean, it's a very controversial thing. I should not comment. There are, these things are mostly comes in the magazines, and you see there will be every 6 months there is a differing views. But yes, at least it's not bad. If you can, if you are comfortable with the taste, it's good. But don't get obsessed with it. That I take only 10 cups of green tea a day and I don't take any food. Don't go into that kind of craziness. If you substitute your tea with green tea, 2 cups a day, 3 cups, that's fine. But don't go into that. Tea is very good, actually. Tea is very good, but without sugar. Sugar is the bad component. Milk may or may not be. People say if you give milk into the tea, the good effect of tea is gone. The tannin is get hydrolyzed and so on. So better to take raw tea without milk and sugar. That actually stimulates your body and is good for sugar is a bit controlled. Your weight may be under control. So tea is good, whether green or normal tea. Coffee was supposed to be good, but only a month or so, 2 months ago, the reports came from America that coffee is not good for the population. So I don't know. These are very controversial subjects.
What about nuts, almonds, and?
As I said, nuts are very good, unless they're salted and unless they're fried.
So don't they have to be like raw nuts, ideally soaked?
Not salted. Salt is not good for your health, So salted cashew nut is not good. You take nuts, maybe what we call that shukno kholai bhaja. I mean dry
roasted.
Dry roasted. Those are good, but 10-15 a day because they're full of calorie. They can give you extra calorie. and you tend to gain weight. So whatever good thing it causes by increasing the good cholesterol, HDL, and decreasing the bad cholesterol, LDL, to some extent, it is eaten up if your body weight increases. So you have to make a balance.
Doctor, we have a lot of questions in the chat. I'll try to take some of them because we are already end of the time that was allotted for this session. But we do hope you don't mind.
I don't mind as long as people are getting interest and benefit, because the whole idea is to spread, it is like this kind of discussion, particularly with non-doctor people, is so stimulating. It's like putting a kind of thing on the pond. It creates a ripple, and that ripple recreates another ripple. So say 100 people, 150 people are listening today and having some impression. They will talk to another 500 people. And those 500 will talk to another 2,000 people. So that's how we spread the healthy knowledge, and which is the whole objective. So please go on.
Sometimes my jaw locks when stretching arms. Is it related to heart attack?
No. As I said, if it is postural, if you're stretching too much, your muscle is going into cramp. Maybe you are deficient in calcium or something. So when you are stretching, if your jaw locks, it's never heart. But if you are walking and climbing stairs and your jaw is feeling tight, then it could be heart, high probability.
Can a frequent increase BPM above 100 be an indicator of a heart attack or problem?
Pulse rate.
Pulse rate.
Above 100. We say nowadays, lower the pulse rate, the better. 60 is the ideal pulse rate, between 60 and 70. Above 70, as the pulse rate increases, chance of heart problem, just not heart attack, heart failure, arrhythmia, everything increases, because indirectly it indicates a high sympathetic tone in your body. Because we are going through a balance of sympathetic and parasympathetic, Parasympathetic reduces the heart rate, sympathetic increases the heart rate. As we are more stimulated, all the time you are anxious. Sympathetic makes you anxious, makes your pressure goes up, heart goes up, pulse rate goes up, sugar goes up. So I think too much of sympathetic is not good. You feel nervous, you feel palpitation, you feel sweaty, your hands tremor. So these are all sympathetic things. So calm down. And again, I said, yoga and pranayam is the answer rather than the medicine to reduce the high heart rate.
My son has just come out of severe GBS. Is he susceptible to heart-related diseases in future?
Look, Guillain-Barré syndrome can cause cardiac problem, but it is usually during the disease itself. Once he comes out successfully with good treatment from GBS, there is usually no residual risk for the heart disease. Maybe for first 3 to 6 months, his heart is a bit weak, and he should not engage into body contact games or hiking or kind of mountain climbing, etc. If you are very concerned, you can have an echocardiogram done after 6 months. And if you see everything is okay, then he lives a normal life as far as heart is concerned.
What are the difference between heart attack and stroke symptoms?
Heart attack is death of heart muscle, and stroke is oxygen deficiency in the brain. So that is the actual medical term, but many people think heart stroke. Heart stroke is actually a misnomer. Stroke means a cardiovascular accident when there is a bleeding or a clot in your brain and one side of your body is weak, or your eyes are different, or you cannot speak, and things like that. So that is a stroke. And the basic pathology is the same. There is a clot in the blood vessel which is supplying either the brain or the heart. So the risk factors are the same. How we treat the pressure, sugar, cholesterol, the blood thinning agents, they are the same. But acute management is different because they are two different organs.
What to understand if echo report has remarks mild concentric LVH?
It is more for the interest of the echocardiographer than the patient. Never mind. unless your blood pressure is high. You check your pressure. If your pressure is high, you control the pressure. Otherwise, just ignore it.
How frequent we need to monitor BP? Is it daily or weekly? And
No.
are the battery-operated machines reliable?
Look, the standard blood pressure machine now recommended worldwide is an electronic machine. There are 3 types of blood pressure machine. The mercury manometer, which you pump like that and the mercury goes up. This is now banned because of the toxicity of mercury, environmental toxicity of mercury. Whoever of us are using it illegally. But what is more commonly used in India is an aneroid, when there is a dial. And we again pump. But that is not so accurate. So the worldwide recommended standard is a electronic, but it varies, from 2,000 rupees to 90,000 rupees. The machine can vary. There are different companies, American, German, Indian, and but take a more or less a reliable one, and that should be the standard. And that's easy for you also to monitor at home, because it is difficult for you to put a stethoscope and to pump the machine. Is rather you just a click of a finger, you get the blood pressure done. How frequently? Now, if your doctor says do it daily, that is a different thing. Otherwise, once at age of 18, your blood pressure is normal, then after 5 years. After the age of 30, every year you do a health checkup, and blood pressure is part of that checkup. Now, once you are a blood pressure sufferer, how frequently you should check your blood pressure? Usually, once it is controlled, you should not check it very frequently, not more than once or twice a month. But in certain situations, when you are not sure what is happening, we ask to check it morning and evening. We ask to do the ambulatory blood pressure monitoring, which keeps your blood pressure checked for 24 hours a day. So that depends on special situation. Otherwise, once it is controlled, and you are a blood pressure sufferer, not more than once a month. If you are not a blood pressure sufferer, maybe once a year annual checkup, not more than that. You can't be hooked to your blood pressure all the time. That increases blood pressure itself. And normal is very interesting. It is 140 by 90 generally, ideally 130 by 80. So we have changed a bit. 140 by 90 was there universally before. Nowadays, 140 by 90 is okay, but 130 by 80 is ideal.
Right. Why the heart can't heal itself after a myocardial infection? Person with fatty liver, G3, SGPT, a person who keeps frequent fasting due to rituals. He's given 2 cases.
So one is that why the heart can't heal. Nothing can heal.
Can't heal itself after a myocardial infection. Case 1 is a person with fatty liver, and case 2, a person who keeps frequent fasting due to rituals.
Number 1, the fundamental thing is that no organ can heal himself. Once the childhood days are gone, during the childhood, you have got some storage cells. Once some cells are lost, other cells can compensate for that. But as you age, whatever is lost is lost. If your liver is damaged, you cannot recreate your liver. You have to have liver transplant. If your kidney is damaged, you have to have kidney transplant. If your heart is damaged, you have to have heart transplant, because the muscle and tissue once lost cannot regenerate. Now we are trying to do gene therapy to regenerate those muscles. But again, this is not very successful. It's far off. So at the moment, if it is lost, it is lost. You cannot really, you don't have enough pool in your store to recreate those muscles and cells. And in a case of fatty liver actually is a bad metabolic condition. It is associated with high triglyceride, with diabetes, with the deposition of cholesterol in the body. So fatty liver is taken up very seriously nowadays, and fatty liver progresses to liver cirrhosis and fibrosis. And there are very few treatments when the cirrhosis is there. So we have to be very careful about fatty liver. Why is it happening? Again, it is diet related. So careful about your diet, whether you are getting any toxin from the environment like arsenic and things like that, whether you are taking any medicine which can cause fatty liver, whether you have got any other disease which can cause fatty liver. So better to see a gastroenterologist because it's a serious thing. And fortunately, there are very good medicines nowadays. So if you detect it, you treat it, you are a normal person. And the second patient was, you said fasting.
Yes, fasting. Frequently fasting due to rituals.
Intermittent fasting. Oh, that's a fashionable thing nowadays. Everybody talks about intermittent fasting. Yeah, particularly the ladies, young ladies, yes. Intermittent fasting. Do you intermittently fast, Saumitra? Do you know what is intermittent fasting? So some people say that I will fast for 20 hours a day and eat anything I like for 4 hours.
No.
And the 20, so conceptually it is good. Some say 16 hours, 14 hours, 12 hours can easily be done from 9 o'clock at night to 9 o'clock in the morning. Conceptually, it means our cells always need food, oxygen and glucose. We need calorie. If I constantly supply it from outside, it will never look into its storage spaces. But if the supply is cut off, then it will unlock its storages and try to get food from there. And who are the storages? Your liver and your abdomen, your tummy fat. So tummy fat will never go if you keep on supplying food from outside. So if you do intermittent fasting, your body will now look into the tummy fat, unlock the door of tummy, and will take some fat out to sustain its minute-to-minute need. And that's how you can lose the tummy fat. It is conceptually very good. There is mixed results, whether it really works or not, because some people take so much between that 4 hours or 6 hours, then it overcompensates than the whole day's food.
So probably what you're eating in those 4 or 5 hours are also important.
Very important. So it's just not the timing, but I am not very sure about, there are very conflicting results about intermittent fasting. Some people say it can cause gastric ulcer because we know from childhood that don't keep your stomach empty for a long time. It causes ulceration because of acidity. But again, there is not any proof that it causes ulcer. So either this way or that way, there is still a lot of debate going on. So it's up to you. If you feel comfortable, psychologically comfortable, that I have fasted 14 hours, I have done a very healthy lifestyle, that gives a psychological boosting, which is very important for positive health.
Doctor, just one last question and I would wrap up. So is doing CT angio test advisable after 50 years of age?
This is very controversial. No, not for everybody, because angiogram has got the radiation hazard. Even if you can afford, I don't mind spending 12,000 rupees, but you have to mind the radiation you are getting that can cause cancer. So it is not a child's game. It's not for fun. But if you have got possibility of heart attack, what we call the pre-test possibility. Now there are absolutely good algorithm how you can predict your pre-test possibility by your smoking habit, your cholesterol, your pressure, your sugar, your age, your body weight, your ethnicity, your gender. There are parameters. If you put into some algorithm, they will say your pre-test probability of having a heart attack is this much. If you say it is high, then you should have a CT angiogram to see whether you have already developed the disease, which is still silent. Another important thing, a bit less than CT angiogram, is CT calcium scoring, coronary calcium scoring, when there is no radiation. And it's a 5 minutes job, much less expensive, maybe 5,000, not 15,000. And it gives a good idea about whether there is calcium deposition in your arteries. And calcium deposition is an indirect evidence of how much your arteries are getting choked. So once your calcium is high, then you go for a proper angiogram. If your calciums are 0, you are fine for next 5 years. Repeat it after 5 years. So that is a compromise without getting radiation, at the same time getting the good of the CT scan.
Thank you so much for this invaluable session. I think the insights that we got from you were immensely in-depth and quite eye-opening. And I'm sure it would definitely help us manage our heart health better. So thank you so much for taking out time from your extremely busy schedule and being with us today.
Thank you. I hope and pray to everybody, the World Heart Day is coming, that if somewhere, somehow, you get a bit more health conscious and spread the news, the how to live healthy lifestyle to your near and dear ones, then our mission is really successful. And thank you, Shomopriya, for conducting so nicely.
Thank you, sir. And I thank all the participants for being with us today and for making the session so interactive. So thanks to all of you. Have a great evening. Bye-bye.